What follows is special programming from WBRN Radio in Boston and on the Boston Red Network. We present King Day 2018 to remember the work of the Reverend Dr. Martin Luther King. And we'll hear a little from his I Have a Dream speech. Now, this was a march for jobs and freedom. And that's still what we're talking about today. When we talk about freedom, we're talking about social justice. When we talk about jobs, we're talking about economic development. As the Chicago preacher, par excellence, Jesse Jackson, used to say, as far as jobs, we had jobs in slavery. No doubt about that. Weren't paid anything. But what we are about today is development. And with the current administration under DJ Trump, you don't hear anything about development. You hear about some jobs being created. Yes, you can create 1 million jobs. But what is happening today is the consequences in some areas that the jobs that are there are not being filled. They either cannot find applicants or find so-called qualified applicants, etc. Thus, those jobs are not there. And that's what gets us to this Decker Act. This is for young people that were brought to the U.S. by their parents, and they were effectively received their socialization in the U.S. and were educated here. Now, it is a business move there, so don't confuse it with some immigrants that are coming for political asylum, etc. This is a sheer economic move by the business community. Why is this? Because these people have been trained here, many of them in universities, some in technical schools, for specific skills, and that is needed in the future economy. What is happening out here on this King Day, it's a little bit different. About 3% pickup in GDP, but at the same time inflation is picking up also. And you have these basic corporations that have given window dressing. Something Dr. King in 1968 when he was killed, I guess we should go over his bio just a little bit here and we'll go to his speech, but he was born in the Depression, 1929. January the 15th was his birthday, and it so happened this day that it will be King Day also. And he died on April the 4th, 1968 in Memphis, Tennessee. He was assassinated by his political enemies. He also, in his final days, after he had went into the peace work, coming out against the Vietnam War. Now, that was a very big situation in that time. The country was in a war in Vietnam that had consumed hundreds of thousands of lives of American people. And it was said the war was for quote-unquote freedom. It was not for freedom. There was no American interest in Vietnam, period. That war was lost. And that was the end of that. But we still have these conflicts today in Afghanistan. A quote-unquote conflict. It's not the same as Vietnam. Vietnam was not the same as the Great War. World War II was against fascism. But today we have fascists walking the streets of America through the alt-right there. They had them working and still do working in the White House in the administration of DJ Trump. And many of the programs that are advocated there, the American First program, is nothing more than a white nationalist program. And a number of people have spoke about that. Professor Rush at Berkeley, how the press treats the particular situation, saying that DJ Trump is speaking in racial sensitive terms. No, he's just speaking racism. Call it precisely what it is and get it down. This whole idea of pointing out the so-called marginal nations as Haiti, etc., as S-hole nations. It doesn't need to be dignified here. But he's basically saying they're subhuman nations. Therefore, those people do not need to be incorporated in America. On the previous administration, Wilsonian policies, etc., some people were given exemptions, such as Salvadorans, but those exemptions are up for renewal. And this administration said they will not renew them. And at this particular juncture, the federal government is again accepting applications for the Dream Deferred or the DECA program. That's the Young Immigrant Program, since a judge in California, a federal judge, has put the kibosh temporarily to DJ Trump's plans. But this is beyond that. What is happening here in this so-called American First situation is in 1968, we'll compare the two. The American population was relatively young at that time, and you had come out of the Great War. You had come out of there 20 years. You'd come out of Korea just about 15 years or so. So 68 was a turbulent year. Dr. King was murdered. Bobby Kennedy was murdered, and it changed the landscape. President Johnson was actually in 68 was the year, but President Johnson's final year. And in November of 68, Tricky Dick was elected president in 1968 on basically the same type of program as DJ Trump. They didn't call it America First at that time. They did not need to. But they used a Southern strategy. Now, it was much more effective in that particular time. But you had the Klan running out there, and no doubt they were running in the countryside, in the cities. But you did not have them at least openly in the government. And that is the difference that you have today. Today, in terms of African Americans, there is less home ownership than at any time. So that means there is less development going on. Let's go to Dr. King's speech. This is the I Have a Dream speech. Then we'll go to looking at the case of Serena Williams and infant mortality rate in African American women, which goes beyond that to the quote-unquote working poor of many races and ethnicities, as we normally do here. But we'll hear a little bit of Dr. King, and then we'll go to the Serena Williams story and our overall graphic about the health care of African Americans, what we call racism in the medical community.
So even though we face the difficulties of today and tomorrow, I still have a dream. It is a dream deeply rooted in the American dream. I have a dream that one day this nation will rise up and live out the true meaning of its creed. We hold these truths to be self-evident, that all men are created equal. I have a dream that one day on the red hills of Georgia, the sons of former slaves and the sons of former slave owners will be able to sit down together at the table of brotherhood. I have a dream that one day even the state of Mississippi, a state sweltering with the heat of injustice, sweltering with the heat of oppression, will be transformed into an oasis of freedom and justice. I have a dream that my 4 little children will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character. I have a dream today have a dream that one day down in Alabama, with its vicious racists, with its governor having his lips dripping with the words of interposition and nullification, one day right there in Alabama, little black boys and black girls will be able to join hands with little white boys and white girls as sisters and brothers. I have a dream today. I have a dream that one day every valley shall be exalted, and every hill and mountain shall be made low. The rough places will be made plain, and the crooked places will be made straight, and the glory of the Lord shall be revealed, and all flesh shall see it together. This is our hope. This is a faith that I go back to the South with. With this faith, we will be able to hew out of the mountain of despair a stone of hope. With this faith, we will be able to transform the jangling discords of our nation into a beautiful symphony of brotherhood. With this faith, we will be able to work together, to pray together, to struggle together, to go to jail together, to stand up for freedom together, knowing that we will be free one day. This will be the day. This will be the day when all of God's children will be able to sing with new meaning, my country, tears of thee. Sweet land of liberty, of thee I sing. Land where my fathers died, land of the pilgrim's pride. From every mountainside, let freedom ring. And if America is to be a great nation, this must become true. And so let freedom ring. From the prodigious hilltops of New Hampshire, let freedom ring. From the mighty mountains of New York, let freedom ring. From the heightening Alleghenies of Pennsylvania, let freedom ring. From the snow-capped Rockies of Colorado, let freedom ring. From the curvaceous slopes of California. But not only that, let freedom ring from Stone Mountain of Georgia. Let freedom ring from Lookout Mountain of Tennessee. Let freedom ring from every hill and molehill of Mississippi, from every mountainside. Let freedom ring. And when this happens, and when we allow freedom ring, when we let it ring from every village and every hamlet, from every state and every city, we will be able to speed up that day when all of God's children, black men and white men, Jews and Gentiles, Protestants and Catholics, will be able to join hands and sing in the words of the old Negro spiritual, free at last, free at last. Thank God Almighty, we are free at last.
That was the Reverend Dr. Martin Luther King. He talked about America and his vision of America and America Great. Now, the campaign sloganeering that you hear today has nothing to do with the greatness of the American nation. It is nothing more than a blight on the American nation. It's what happened in London. Some right-winger walked into a speech by the mayor of London, Mr. Khan, one that had been disparaged by DJ Trump, and literally tried to make an arrest. I mean, this sort of thing we did not see in the public sphere. We saw it with the Hoods and the Knights, and when Dr. King was killed was a different time. Let's go to our healthcare feature, because many people will be making speeches tomorrow, no doubt about it. There will be speeches made all over the place. There will be various acclamations made to Dr. King and his work. But also at the same time, the grassroots work goes on. Chelsea Manning, incidentally, is running for the Senate in the state of Maryland. Those kinds of grassroots campaigns are what makes America great. And you'll see more of that this season coming here. Anyway, nonetheless, this is a new mom, Serena Williams, had to talk to her medical staff about saving her life. This is from one of the sites here. Of course. Anyway, Serena Williams, the world's greatest tennis player, new mother, etc., graced the cover of Vogue for February, together with her daughter Alexis. Who at 3 months is the youngest Vogue cover model ever. She has already listed one Grand Slam win and still is in utero. Anyway, in the cover story, she talks about her new life as a mother, wife, and her career. This is Serena Williams. The piece also shares a terrifying episode in which Williams tells the story of delivering her child, the day that followed, and how she risks dying after an emergency C-section. Williams encountered what is often a fatal complication, blood clots. She also had to fight to be taken seriously. Now, we talked about this before, and this is a very unfortunate situation. The next day, while recovering in the hospital, Serena suddenly felt shortness of breath, a sign of blood clots. I was talking to a lady the other day that had a similar situation with 100 blood clots. Because of a history of blood clots and because she was off of her daily anticoagulant regime due to recent surgery, she immediately assumed she was having another pulmonary aneurysm. She lives in fear of blood clots. She walked out of the hospital room so her mother wouldn't worry, and told the nearest nurse between gasps that she needed a CT scan. I've had one of those, with contrast and IV heparin, that's a blood thinner, right away. The nurse thought her pain medication might be making her confused, but Williams insisted, and soon enough, a doctor was performing an ultrascan on her legs. I was like a Doppler. I told you I need a CT scan and a drip of heparin drip. She remembered telling the team the ultrasound revealed nothing, so they sent her for the CT scan, which she should have had anyway. Sure enough, several small blood clots had settled in her lungs, and minutes later she was on the drip. I was listen to Dr. Williams. That's right, only hours after giving birth, a major surgery, Williams needed to convince the medical personnel that she was in need of care. She ran through what she needed, and she luckily survived, became one of an estimated 150,000 women in America to experience serious illness and near-death experiences after pregnancy. Because of her history of blood clots, made her aware of the symptoms, Williams was able to save her own life. Unfortunately, between 700 and 12,000 American women every year don't live to describe the experience of giving a birth. With shockingly high mortality rates is several times the level of other rich countries. Williams' story would likely sound familiar to many women and more to African American women, and this is why we are highlighting today. 3 times more likely to die or suffer serious illness from pregnancy-related causes than European women, at least 40 deaths per 100,000 live births on the average compared to 14 for European women. And a little charty, we'll see if we can put it on the deal. That means African women in America have a higher chance of dying during or right after pregnancy than women in developing areas of Central Europe or Eastern Asia. What Williams had to go through is especially revealing about the medical bias faced by African Americans. This is why we include this in the report. According to the American College of Obstetrics and Gynecology, at least 46% of material deaths among African American women could be prevented, versus 33 for European women, when pointing to the systematic dismissal of symptoms and of patient complaints, and less paid attention overall, and how racial bias in the medical profession is well documented. We'll go to that in a minute here. This is just something that affects African mothers of lesser, not something of lesser means. It happens to even wealthy, highly educated ones, and those the ones who are acutely aware of medical symptoms. African American doctors, lawyers, business types. They still have a higher infant mortality rate than European women who never went to high school in the first place. Michael Liu, a natural specialist who had studied the impact of discrimination in newborn health, explains this in a documentary where the bulge breaks. Indeed, even Serena Williams, whose body, as her husband correctly noted, is one of the greatest things on this earth, is just another African American woman when it comes to being heard in the maternity ward, and when it comes to being dismissed there. And this is from the NCBI, a resource here anyway, preventable pregnancy-related deaths results of a statewide review. Just one of the things put up here: risk of death of complication of pregnancy in the 20th century has decreased dramatically. Several lines of evidence suggest that it has not reached the irreducible minimum. And to further reduce pregnancy-related mortalities, we must understand that deaths are primarily preventable, and the changes need to prevent them. The North Carolina Pregnancy-Related Mortality Review Committee reviewed 108 pregnancy-related deaths, women who died during or within 1 year of the end of pregnancy from complications of pregnancy, or its treatment that occurred in the state 1995 to 1999. For each death, the committee examined the cause of the death. Overall, 40% of pregnancy-related deaths were potentially preventable. This varied by a cause of death. Almost all deaths due to hemorrhaging or complications of chronic diseases were believed to be potentially preventable. That is one of the things there. Let's go to this study here. Now, this is Health USA 2015 with special feature of racial and ethnic health disparities. The report was updated in 2017 to reflect corrections to 14. The changes appear in the highlighted areas. The final data is available there, and we won't go to it in this for our. We will append it, however, there. And this is the National Center for Health Statistics, the United States health disparities. Anyway, this is just some of the business end of it here. And see if we can, as they say, quickly ascend here through this report. And we're not ascending very quickly here. Is this? I assume this would be going much, much more quickly. and it's not. Between 2004 2014, all cause adjusted deaths were decreased by 12% amongst males, 11% amongst females. This is causes of death. The age-adjusted death rates declined 29% for strokes, 23% for heart disease, 16% for cancer, 10% for both diabetes and CLRD, increased 11, Alzheimer's, etc. Here, this is deaths. I'm not sure where this relates to us. Risk factors, obesity, emergency department utilization. Within 12 months, adults 1864 by types of coverage. Uninsured, private, uninsured 15.1, Medicaid 23.4, private 53 there, and others. Wish we'd had okay, here we go. In 1985, the report of the Secretary's Task Force on African Americans Minority Health, released by then Margaret Heckler. Anyway, this is a long time ago. This is under Reagan. Race is a constant construct in influencing a complex set of factors because of the complexity and difficulty with conceptualization and defining race, which is a lie. 23% of the population were considered racial or ethnic minorities. 22.3. This is a long time ago. 37% of the population as racial ethnic minorities. In 2014, Latino persons who made up of any race comprised 17.4%. They're non-Latino 2%. It doesn't really matter very much there. But what is starting to happen there at this 37.7%, understanding the demographics and social economic composition of the groups is important because 1/4 of African American, 26.2%, live in poverty. Well, that's one of the causes, and this is why we're talking about this on King Day. But some of this information here, and life expectancy by birth, sex, race, outcomes there. Life expectancy for males, let's see, 79.2. This is in 2004, incidentally. At birth, 76.5% for Europeans, and for African Americans, 72. At 72. This is for males. Females, 84, 81, and 81.1, and 71. These are the life expectancies here. Infant mortality rates, they're very, very high. Of a baby before his first birthday. The infant mortality rate in the U.S. decreased from 7.4 attempts infants per thousand in 1999 to 6.75 in 2007. During 2013, non-Latino African mothers experienced the highest infant mortality rate at 11.11. In 2003, infants born to Asian Pacific Islanders was at 3.9. You can see where this is going. So these very, very large numbers here in this very, very large study does tell where one is going in terms of deaths. Literally, very, very sad situation here. We won't go much more into the study here, but what we will do, excuse me, obesity with children, adults age 2 to 19 by age, etc. You can see these disparities coming on here. For Latinos, 21.9, 19.5. Here, let's see, who are we? Okay. It's 14.7 for Europeans. This is 2 to 19 years old here, and for African Americans, 19.5. So you can see what some of these health problems are coming here, and health coverage. This really goes into everything we want. The difference between a high and lower percentage of adults will get from age 18 to 64 without a coverage increased from 17.9 to 20 and this is during 1999 and 2013. So it's even the CHIPS program here. It passes the Affordable Care Act, major determinants in access. So you'll see what has happened here in terms of access to health coverage. Very broad situation with the Affordable Care Act helping in some of the disparity here. Even dental care and various other things here. Disability indicators amongst 18 and older by sex, and males 6.1 on the disability scale here. Females about 5.3. So some of the things going on here. This study is a very, very large study, and low birth weight, live babies by race, etc. We can look at that. I mean, there's just a lot of things here in these various states and what is happening. This really goes into it. We'll append this study and we'll move on from it. But now you tend to understand what is going on here and what happened with Serena Williams, a person that is very cognizant of what is going on with her. We talked about the DECA protection now. They're now taking applications for DECA, that is Deferred Action for Childhood Arrivals. As a judge there, what is 690,000 must retain their work permits, so they're going to retain those. And they will move on with that program, at least where we are right now. This is sort of a little bit roundup. We talked about the London story. Incidentally, in Hawaii, there was a false missile alert there. Ballistic missile threat inbound to Hawaii. Seek immediate shelter. This is not a drill. This was actually sent out by the government of Hawaii. Mobile phone users received a message. Ballistic missile threat inbound. And that was basically what happened there. The government apologized for it, but again, there you go. I mean, it was out there, and it was corrected by email 18 minutes later, but there was no follow-up mobile text minutes for 34. This is from the Honolulu Advisor. We fall back on them quite a bit out here covering elections in Hawaii, and evidently this was it. We'll put it on our Facebook page. It show a picture of officials in the state of Hawaii. Anyway, we'll move on here. The approval rating, what is it? Emerson, DJ Trump at 39, 46 at Rasmussen, and 35 at the was on Thursday at the Independent Business Daily. So it's a little bit of what is going on. Generic ballot is a little closer there, and well, I guess Quinnipiac has the Democrats up by 17, and so forth. Let's let me just check our time here, and we'll do the We'll do the sports, I guess. It's a very good time to do the sports there. But we do really want to highlight the medical problems and exactly where they were going here. Anyway, let's see. We'll go to National Basketball Association. The Lakers were at the Mavericks in Dallas, 107-101. The Kings at the Clippers. Clippers in Los Angeles, 126-105. The Thunder was at the Hornets. The Thunder 101-91. In overtime, the Nets were at the Wizards in D.C. The Wizards 119-113. The Warriors were at the Raptors. Warriors 127-125. The Raptors were at the Bulls in Chicago. The Bulls pulled that out by 2 points, 107-105. And finally, the Nuggets were in San Antonio. It was a blow-away game there. Nuggets 112-100. In the National Hockey Association, what do we have going on here? The Islanders and Rangers. Islanders 7-2. The Red Wings and our Penguins. Penguins 4-1 in that one. The Bruins and Canadiens 4-3. Bruins in Canada. The Flyers and Devils in Detroit. Flyers 5-3. The Jets and Wow 4-1. The Avalanche and Stars. Avalanche 4-1 there also. The Oilers and Golden Knights, that's the Vegas team, in the final overtime, 3-2. Oilers. The Ducks and Kings, Ducks 4-2 in that contest. The Coyotes and Sharks, 6-5. Sharks over the Coyotes. And in let's see, where are we going here? College basketball, we had Villanova, number 1, 74-81 over St. John's, West Virginia, and Texas Tech Red Raiders, 72-71, Texas Tech. Michigan and Michigan State's number 4. Michigan pulled that one out, 82-72. Purdue and Minnesota, a blow-away there. Purdue is number 5, 81-47. Wichita State, one of the teams that we follow in March Madness, 72-69 over Tulsa. Wake Forest and Duke. Duke 89 and they are number 7-71. And in overtime, TCU and Oklahoma, number 9, 102-97. Creighton University and Xavier 92-70. Oregon State and Arizona State 77-75. Kansas State and Kansas, 1 point game there, number 12 Kansas, 73-72. Georgetown and Seton Hall. Seton Hall's number 13, 74-61. And Cincinnati and South Florida. And then Cincinnati is number 14, 78-55. Below way there. Gonzaga out of Washington State and San Francisco. Gonzaga 75-65. They're number 16. Oregon, the Ducks, and Arizona number 17, 90-83. Arizona over the Ducks. And the University of Miami and Clemson 72-63. North Carolina and Notre Dame. North Carolina 69-68. Kentucky and Vanderbilt. Kentucky 74-67. Then number 23 in the rankings. Auburn and Mississippi State 76-68. Auburn over Mississippi State. And in a second overtime, Syracuse and Florida State 101-90. Texas A&M and Tennessee 75-72. This will do it for us. We wish everyone a happy King Day, and we will go out with a man that fought against racism, Stetson Kennedy. We'll see you on the Monday Morning Quarterback on Monday morning. And we also have Numbers Man, macroeconomics program. That will come this weekend also.
Jacksonville. A child was born that couldn't sit still. 86 years later with no regret. You know that man can't sit still yet. The Great Depression couldn't get him down. He worked for his dad's store in town, collecting money in small amounts for poor whites and blacks in their furniture accounts. Stetson Kennedy wants us all to be free. Stetson Kennedy wants us all to be free. As he'd collect, he'd talk to folks. He'd hear legends, tales, songs, and jokes. Now this fine treasure he'd record and write. He was colorblind, didn't see black and white. Writer's project for the WPA. Zora Neale Hurston, he earned his pay. Crackers and blacks, they talk for hours. It was a barefoot history in this land of flowers.